Hi everyone, I'm your fave nurse B. Today I want to talk to you all about nursing clinicals. So to start off with, I did not like clinicals at all. So I want to tell you all like my experience with clinicals. Just so you know, I am an LPN. I have been a nurse for 3 years. I'm a charge nurse at a long-term care facility. I went to a technical school for 1 year. We did fundamentals, MedSurg, Peds, OB, MedSurg 1 and 2, Pharm, all that good stuff. Only clinical site that we didn't go on was OB, but we did do something that was pertaining to OB. So I'll just go over like where we went and my experience there, and just like kind of what to expect when you go to clinicals type of thing, but mostly like my experience with it. So yeah, like I said, I wasn't like a huge fan of clinicals to begin with. So first off, we had fundamentals of nursing. So for that clinical, we went to a nursing home, and mostly like fundamentals of nursing clinicals is like CNA work. A lot of people would explain it like that. We would do the AccuChecks for lunchtime. So right before lunch, we would do AccuChecks. We also would do wound changes. We had some experience taking out staples. I think we removed sutures. Yeah, I remember somebody having, was it staples or sutures that she had in her head? I think it was sutures. We removed, no, they were staples. We removed staples. We did like catheters on male and female, which was pretty interesting. We had one guy, I think he got straight cath like every day. So that was like a lot of experience doing that. And then I did a female catheter. I remember her having, I think it's called I want to say a fistula, but that doesn't make sense. I forgot what it's called, but it's like something to like keep your uterus, like, it helps with like uterine prolapse. So it helps to like keep it in, I believe. Anyways, it made it so much easier. Like the urethra was right there. It was just so easy to get in. But we did that. And then speaking of prolapse, like we had a patient who had like a prolapsed uterus. So that was something new to see that. So yeah, we did that. Trying to think anything else that we did at that clinical site. We did not administer medications. I don't think there's really any clinical sites that, yeah, we did administer at one, but not there at the nursing home. So it was fine. It was cool. We had a pretty good instructor. For real, with like clinicals, the thing that makes it fun is like whoever you're with. So if you with a boring group of people, like, it makes the time go by so slow. Like, I don't know what it is about clinicals, but like for me, just thinking about it, I was just like, but really it does go by fun. Like if you got like somebody that you're really cool with, like that you can become cool with, even if initially you're not that cool, but just somebody you could like kind of talk to and laugh and like point at stuff and laugh. At least for me, like I need something to entertain me, unless I'm like sitting down and grind like study mode. If I'm sitting down in class and study mode, I can do that. But if I'm out, you want me to be out and about, I need to be with somebody that I think is fun to be with. So yeah, it was cool. One thing that we did have to deal with, like state came in the building. So our clinical instructor was like, we're going back to the school. We're not going to be here while state is here. So we had to go back to the school and do like clinicals on lab, like at the lab at the school. We did on-site clinicals. So that was okay. So I would say overall, like fundamentals clinicals weren't bad. I think they were pretty good for what it was worth. Some people did CNA work. Like I didn't have to do any showers. I think I did like I changed my patient. I fed my patient. You do a lot of changing and feeding. Like what else did we do? I think that was it. Like as far as me, like I didn't have too much grunt work to do at fundamentals. Let me see what else we did. We also had like this respiratory therapist, like right before we even started clinicals. We went to a facility and she was just talking to us about like how to take care of patients with trachs and things like that. And it was really interesting. So we saw her clean out a trach and, you know, suction the patient and all that. So that was okay. And if you're not planning on going to nursing, or maybe you're a CNA or something like that, like look into respiratory therapy, because they make a really good living. You make your hours, like you can have clients, like you can just go to your client's house. Like it just seems like pretty chill, you know, pretty chill gig to have. I'm trying to get one of my friends at work to do it, one of my coworkers. I think she'd be really good at it. But anyways, look into that if you're interested. Let's see. We also would do assessments during fundamentals clinicals. So basically, like, we would do our regular head to toe, do our vital signs, and then we write like little mock what do you call them, nurses notes. So patient alert and oriented ×2, no complaints of pain, resident consumes 75% of meals, 80% of liquids, 2 small BMs, like that type of thing. Like you would kind of go through that, and you'd be like, resident has bruised to right arm, resident fell Friday and bruised right arm, that type of thing. Like we would do those type of assessments, kind of just sitting there doing it. Of course, you had like one patient, so the teacher would like, depending on your clinical site, like they will put you up with like a patient, like one patient, really. And in real life, you're not just gonna have one patient. Maybe like ICU, but yeah, so they get you one patient and you would just be with them all day and just write up an assessment or a nurse's note on them. So that was okay. MedSurg, I would say, probably was the most fun clinicals, because we went to a hospital, and the person that I had was really fun. She made it fun. Like the nurse that I followed, we did a blood transfusion. So we actually went down to the bank, the blood bank, and checked everything, and then went up to the patient, did the transfusion. We monitored her afterwards. Like it was really fun and interesting. I saw NG tube. It wasn't placed, it was already placed in, but that was cool to see. We saw did we see a lot of dressing changes there? I saw a few dressing changes. We did some bed baths there. What else? I did my first IV when I was on MedSurg. I was in a hospital, and it was like the end of the day, and the teacher was like, if anybody wants to do this IV, like, you know, you can do it. Everybody else left. I decided to stay and do it. The patient, this was like her first day of rehab. She was about to go in and get treatment for alcohol withdrawals. So, you know, when you stop alcohol, like you can't, if you're an alcoholic, like you can't just stop drinking. Like you have to have some type of medical attention, and otherwise you're gonna die from alcohol withdrawals. So she was there, and it was her first day, so she was already like on edge, probably hadn't drank in whatever amount of hours, and she was already like really like nervous, I guess. So she was, and she let me do her IV though, and I got on the first stick. Like I remember she had a butterfly tattoo on her arm. Like I remember all of that. Like I did it, and I was like, oh my goodness, I feel like if I could do hers and not be nervous and just be like, okay, I'm gonna do it, like I could do pretty much any patient. Now I'm gonna tell you, them elderly patients, they throw you for a loop every time you try to do their IVs, but I felt good about doing her IV. Like that was really cool. I'm glad I stayed active for that. And I'm gonna do a video after this telling you all like how to stand out in clinicals, how to like be the bomb when it comes to clinicals, okay? So we did the blood transfusion, we did the IV. Some people went to the dialysis clinic. I didn't go, but I have heard that LPNs make a good amount of money in a dialysis clinic if you can get in one. They make some money, okay? So we also went to the wound clinic, which was like so fun. Like I loved going there because it was so fast paced. Like you had new patients all the time coming in, and it's just like you just go in, do your measurements, clean it, all that. I saw somebody's cast, like they drilled the cast off, like they cut it off and they had to put a new one on, and it was really interesting, really cool. I like just the fact that you're getting new patients in, you're getting them in, you're getting them out, and it's like a teamwork type of thing, because 2 people will go in. You have a case manager, which at the time I think they said something about they were going to stop the LPNs from being able to be case managers or something like that, but there was an LPN working there. She was the case manager at the time, and then they had another nurse that would actually do the treatment. And so she would just kind of read off, is this amount of measurements, and the other nurse would, you know, type everything in. And so that's how they worked, and it was really, really fun. It was one thing that I learned there was the nurse. I remember she had a little blonde bob, and she was like, I said, you know, if there's anything that you could, like tips you can give me as a new nurse. She said, just remember this, you're never alone. And I'm like, you know what, you're right. I think I said this in another video, but I was like, she's so right. Like, she's like, no matter what, you're never alone, so don't worry about it. And it's kind of like, I was at the time, I was like, that's all you got for me. But actually becoming a nurse and working as a nurse, like, you realize like you're not alone. There's always somebody to help you. Even if you do home health, there's always some type of, like, you know, if you're going through agency, there's always somebody you can call and be like, da da da, I need this, da da da, I need this. And like, you're never alone. Like, you just can always ask for help, and hopefully there's somebody there to help you out. You know what I'm saying? Like, nursing is 24 hours. Remember that. Remember that. So I did have a good time doing MedSurg clinicals. It was really fun. Like I said, being whoever you're with is gonna make your experience fun, the people that you're with. And if anything, you better make it fun yourself. I try to talk to anybody just to keep up. Even people that work there, I try to make friends with them if the group I'm with is boring. Okay, I'm gonna get some type of entertainment out of this. So that was that. And then our peds clinicals, what we did for peds is we went to a children's home. So these were children who either they were given up to the state, or their family couldn't take care of them at home, so they had to be in this home, something like that, or they were like a temporary placement there until they are able to go back home. So it was really sad. Like, I don't really plan on doing peds at all. It was sad, especially now having a daughter, like thinking about like everything that can go wrong, you know, with your child. But at the end of the day, like, children are so resilient, and they just enjoying their life. You know, they don't really see it as, oh, I'm so different, da, 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 because everybody there is different. Everyone there is, you know, needing care. But I enjoyed it. It helps you to just be humble, you know what I'm saying? Like, and it helps you to have more compassion. But what we did there was we did showers for our patients. And it was mostly just like being with them, just being around with them, playing with them, talking to them, singing to them, like doing that type of thing. What else did we do? I think that's really all that we did at that clinical site. The instructor was really fun. She was fun and really like lighthearted, and like, you know, she was cool, so she made it fun. But it was nice being around the kids. I thought it was sad though. But, you know, they were kids still. At the end of the day, they were kids. A lot of kids had like trachs. They had special wheelchairs. Some of them were like contracted if they had any type of like neurological issues or damage. They were contracted because of that. And you could go through their care plan and like get an idea of what happened. Some of them, they had like abuse, like their parents abused them. So that's what really made it just like, man, you know, especially at that time, I wasn't a parent, but now looking back, like, wow. But that's what we did for peds. And I'm glad that we had that experience of going there. So that's that. So for OB, instead of going to like see a baby born, I think back in the day, like you were able to see a child born, but we didn't see that. So what we did was we went to Job Corps. I don't know if they have that all over the US. So basically it's a place for people to go, like say for instance, like you didn't graduate from high school, you go here and it's like you get like training. And I think you can also get your high school diploma through their program and your GED, and you get like, you go through like you get a trade or whatever. I think CNA is one of the trades you can get while you're there, but you live on campus. So we went up there and we did all the assessments for the people coming in, and we went through the whole little spiel with them. That this guy, he talked about like, oh, remember, he like talked to the people, and he like went through like this whole long thing about not smoking weed, and if you do, if you're test positive on like all the stuff that can happen, it was crazy. Like we went through the whole thing as if we were about to go into the school, as far as like hearing him say everything to everybody, like the introduction. And then we did all their assessments. So we would do like vision tests, hearing test. Did we do hearing? I think we just did like color blind test, which that was so weird to me. But we did a vision test. We did pregnancy tests for all the girls, and we did TB shots for everybody. So I can do a TB shot, honey. So yeah, we did TB shots. What else did we do? I think that's it. We just did their assessment coming in. So that was okay. It was different. It was different to work with a different age group. So of course we worked with kids, and then like at the nursing home we worked with the elderly, and then when we were in the hospital, it was kind of a mixture, but you would still get geriatric patients in the hospitals too. So that's basically what I did. Now I would say like personally, I I don't know so much that if I learned a lot. I did learn a lot on clinicals. I can't even lie. I did. It's just, I think that nursing schools have an issue with securing spots for clinicals, and also making sure that their students are constantly being engaged, because you never know what patients are going to be there, what's going to happen, how the nurses are going to be when you get there, if you're going to be able to even find anything to do or do anything. We did go into the computer systems at the hospital. We went through this a little training, and they taught us how to do computer charting and all that type of stuff. So that was cool for what it was worth. I mean, it was still a lot of work, a lot of work. We couldn't really do everything that we, you know what I'm saying? It wasn't, we couldn't learn everything on the computer, so we were kind of just playing around with it. I feel like it was play charting on the computers, because a lot of that stuff I was just so confused about with the computers, especially because at my facility we don't have computers. Oh, something else that we did, we went over to this hospital called St. Alexis here in St. Louis, and it's basically a psych hospital. So we had the option at my towards the end, MedSurg 2, we had the option of, you could either stay in your clinical group, or they found another site with the hospital, which is St. Alexis Hospital, and they had the option where you could do a later evening clinical, and you could be at the hospital. Now, everybody else at this point were doing probably clinicals at nursing homes. They weren't going to the hospitals. So I was just you know what? I got the time as far as my work schedule. I want to do it. Even though my clinical site, the people I was with, I liked them, but I was just you know what, it's probably gonna be better for me to do this, to get more experience. And I'm glad I did it. And I still found people that I liked in this clinical group. It was just the evening clinical group, you know what I'm saying? So we would go to the emergency room, and we would have, it was really a psych hospital, for real. This was where a lot of the psych patients was there. So, you know, it was a lot of giving, a lot of Haldol, if you will. And they had a whole unit. Oh, speaking of psych, our psych clinicals. So we went to this hospital for our psych clinicals, and they had a floor for women, a floor for men, a co-ed floor, and then a geriatric psych floor. So we went on the co-ed floor during our psych clinicals, and we were in these, they have this furniture that you cannot move, because I guess people inside, they flip stuff around, throw stuff at you, that type of thing. And I hate to say it like that, that's stereotypical, but that's what can happen on at these places. So all the furniture is huge. It's I'm trying to think, those play school chairs are plastic, so I don't know, that hard plastic chairs, and it was filled with sand. It felt like you could not, you could barely push them, you know, there's no way you're gonna be mad in a rage and pick it up and throw it at somebody. That's not gonna happen. And they would teach you, you know, if you're gonna be talking to people, around people, always have your back to the wall, you know, do not have people behind you, watch your back. I would not be able to work in that situation, because I can't, no. Some people are able to work with psych patients, and they can joke around with them, they can curse at them, they can do all that. They I'm gonna talk to you how you talk to me, I'm gonna handle you the way you handle me, type of thing. I really can't see doing that. But most of the nurses there at psych facilities, all they do is give meds. That's pretty much what all nurses at psych, and I've asked people. I know somebody that graduated from my program. She's the LPN. She works in a psych facility. She said they give meds, and they'll do a little bit of charting. There's really not that much to it, though. Not to say that you're not doing anything, but that's pretty much all you're doing. The nurses were in a... So first off, it stinks. I don't know why it stunk so bad. I don't know if people were just peeing, or if I don't know what they were doing, but it was funky. So you come onto the unit, and it's just this long hall, and then in the middle of it, so there's a nurse's station in the middle, there's a hall on each side, and then behind the nurse's station, the two halls, the nurse's station, behind that is the little group room, and then everybody's rooms is on those along those halls, and there's this huge group room. And the nurse's station is completely blocked off, there's glass everywhere. I don't think it's glass, but you know what I'm saying, it's blocked off. And it just seems gloomy and yeah, gray, the lighting is orange, it's weird. But yeah, that's how it was. And their sinks, they don't have deep sinks. The sinks are this, so that way you won't be able to like drown. You can't, you know, suffocate yourself in the water. They can only drink a certain amount of water like in their room. Like, I don't think they can take anything in their room, any food or anything in their rooms. So, and it was a lot of young people there. I do remember going to the intake at that psych hospital, and they would kind of say like, people, a lot of people come in again, like they come in over and over, and you get younger people coming in. If they can't stay at that facility, then sometimes they have to send them like to nursing homes, which is, I think, like, I'm like, what? But yeah, they was talking about that. But it was okay. I wouldn't be able to do it. It seems like easy money to work there. That's what I've been told, but I wouldn't be able to do it. So yeah, that was how that was. But going to the hospital was cool. Like, we would go to the ER room, which it wasn't like your typical ER room, because like I said, it was a psych hospital, so you didn't get a whole lot of action. But it did teach you to be able to nurse that group, you know what I'm saying, that psych group, geriatric psych, people who are either on drugs or who have been homeless, like that type of thing. And it's like, you just have to learn to just treat them like people with respect and be professional. But you have to try to get your information from out of these people, and you have to kind of really use like some nursing judgment when it comes to caring for them, as far as protecting yourself as well. This guy, a nurse there, he told me, he was like, you know, my wife was working at a geriatric facility, and somehow the guy stabbed her or did something to her, and she's paralyzed. So yeah, which can happen working anywhere, really. People can do anything anywhere, but of course the risk of it happening is kind of higher when you deal with psych patients. But that was my experience with clinicals, you all. This video went on a little bit longer than I wanted it to, but that was my experience. Overall, I felt that it was very useful, but it was boring at times. Yeah, like I said, the people make it, to me, it's like going to work. Like, it was like another job. Like, I already got to go to school, I already got to go work as a CNA. Now you want to go pay to work as a CNA because you're paying for clinicals. You pay for the school. It's part of clinical. So you paying me to go work for somebody. I don't want to do this. But it was cool, yeah. It was cool. I ain't gonna lie. You had to wake up early though. So yes, that was my experience. Let me know if you all have any questions, comments, concerns. Like, comment, and rate this video. Share it with somebody. Go join the YourFavNurseB Facebook group. It's growing. I think we're like at 150 right now as far as members, so go ahead and join that. All right, you all, thanks for watching. Peace.